Hello, guys. So, what we are doing today? Today, we're going to be learning about surgery from a very famous book, Estas. And if you want to get good in clinicals, this is the investigation of choice, right? So, uh, so we can say book of choice, right? So, the topic for today is examination of an ulcer. What is an ulcer? Ulcer, or commonly known as open sore, it is literally a break in the continuity of the covering epithelium, right? Um, in whole of the body, there is covering epithelium, which literally covers things, right? So it could be skin or it could be in the mucous membrane. So whenever there is a break in the continuity of the skin or the mucous membrane that is inside, then we call it an ulcer. So it could be due to molecular death of the surface epithelium. So there was necrosis, and there was just an open space because of it. Or it could be due to trauma, right? So whenever we do, clinicals and we do history taking examination, where do we start from? Obviously, history, right? So in history, what are the points that we need to take to examine the ulcer? Not examine, but like learn about the ulcer from the patient's point of view, right? And then in examination, we will try to corroborate whatever the patient has told us, whether his subjective knowledge is right or, he's missing something or we miss something, right? So, first is the mode of the onset. For the mode, like how the ulcer happened, right? So, it could be traumatic or it could be spontaneously, right? Traumatic. What do you mean by traumatic? Whatever trauma happened, right? The body is like so good at healing itself, right? It is, one of the most amazing structures out there. So it heals by themselves. But what if, the trauma persists? You don't give time to the body to heal, right? Body needs time to heal. But if the trauma is happening again and again, you're not giving it time, then it will turn into a chronic ulcer. And one of the example would be a dental ulcer of the tongue. The teeth is, just hell bent on destroying the tongue. That is when it will turn into chronic, right? Or it could be over a joint, like you are hell bent, right, on using that joint. So, pun intended, right? So the next thing would be it could be spontaneous. What do you mean by spontaneous? Spontaneous means it's not exactly like, one fine day body was like, I have nothing to do. I'm just gonna have an ulcer. No, there was something behind the, you know, etiology of the ulcer. So there may be matted tuberculous lymph nodes. There are lymph nodes in your body, right? It could be matted, like the mat locks like hair, right? Very hard, and um, these are called matted lymph nodes. That could be due to tuberculosis because it spreads there. Or it could be gamma. What is a gamma? Let's see. Gamma is this. What do we see here? Gamma is this flat, fleshy, flat, fleshy ulcer that is usually in the tertiary stage of syphilis. Syphilis is a common, sexually transmitted disease. And in the tertiary, like the last stage of the syphilis, where, the systemic involvement has occurred, that is when gamma occurs. So it is usually over the bony surfaces, right? So that is why it's very shallow. So next thing, it could be gamma, right, like we saw here. And it could be due to malignant melanoma, right? Over the What is a melanoma? Melanoma is a cancer of the melanocytes. The skin have melanocytes which have melanin, right? That's why you are somebody's dark, somebody's light, somebody's, fair, Caucasian, whatever, right? So that is because of melanin. And whenever it turns malignant, like due to UV or something else, right? UV rays, it would become a melanoma, and then it could become into an ulcer also. Or the ulcer may be due to the varicose vein. What are varicose vein? Varicose vein are the veins, usually of the lower limbs, right, that are dilated, that are enlarged, and that are tortuous. Like these are like this, right? If I show, it's like this over the leg, right? So obviously the blood supply is very very bad there, right? The blood is pooled there, so there could be an ulcer because of that. Or vascular, good old vascular insufficiency, like here the veins are problematic, here mostly arteries and arterioles are problematic, and there's ischemia, like lack of blood supply. And obviously whenever there's no blood supply, things can die off, right? And there could be a malignant ulcer. What is a malignant ulcer? That was malignant melanoma, right? But what is a malignant ulcer? Like there is an ulcer which is which has a potential to turn into malignancy, which is usually a squamous cell carcinoma, right? And the perfect example would be the Marjolin ulcer. So what is a Marjolin ulcer? You know, whenever there is a burn, whenever the burn heals, there is scar formation. Obviously, like whenever anything heals, there's a scar formation, right? But especially in this burn case, whenever the scar is formed, in this scar, this marginal ulcer can form, and this can turn into malignant. Right? So there's the people for the people who know Hindi, or even the some semblance of Hindi, right? There's jalna, right? Jalna. So jalna associated with burn, jolly burn, right? All of our Assamese and Bengali subscribers will also agree, jolly jolly, right? Burn. So anyway, the second point. So that was the first point, mode, right? And the second point would be duration. So with everything we see, भाई कितना time हो गया उस चीज को, right? Duration. How long have you been suffering, right? You ask the patient. It could be acute or it could be chronic, like we saw, right? What makes ulcer chronic, right? So with whenever time is put into the picture, we have to see some period, right? Incubation period. How long was this disease into the oven? It was incubating. It was just be like, yeah, just let me be so strong that I'm going to take over this individual, right? So this is what is incubation period. It is a time interval between the exposure, right? Whenever we're exposed to something, right? Something bad, something good, right? And that is the exposure. And after some time, it's gonna plot against your body, and then the onset of ulcer will start. So like it's like a normal incubation period for communicable diseases, right? Exposure and the symptomatic, right? But in case of ulcer, obviously it's right, it's the onset of the ulcer, right? So for different diseases it's different. So syphilis, like we learned about gamma, the tertiary syphilis, this is a Hunterian cancer. This cancer is usually a primary syphilis. So the primary syphilis, it takes 3 to 4 weeks. Normally, for syphilis, the incubation period is 9 to 90 days, right? So, um, in this much time, this cancer will develop, right? It's nothing much. It's just an ulcer for the syphilis. This is called cancer. Or it could be chancroid. What is a chancroid? It sounds eerily like a cancer, but it's not. It's a soft sore. So, if this is a soft sore, this is a hard sore. Hard and hunter. Hunters are hard people, right? You need courage to do what they do, and it takes a lot of time to hunt. Like you have to be on the lookout, right? But chancroid is soft to do soft things. You don't need that much time, right? What is a chancroid though? Chancroid is due to this organism. This is Haemophilus. We have all heard about the Haemophilus influenzae, right? But this is the Haemophilus ducreyi. It literally makes you cry, right? So to remember chancre and chancroid, you can see the D, 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 right? So chancroid, this is a Haemophilus ducreyi. And why did I say cry? Because it will be so painful that you will cry, right? So next point in noting for the ulcer, is the ulcer painful? And only those ulcers associated with inflammation will be painful. That is so obvious, right? So before we go to that, let's just see this. So this is a mini classification of the much broader classification that we have to do for all the STD associated ulcers, like the sexually transmitted diseases. So it could be painful, it could be painless, right? These are like the classifying categories. And for the painful, it will make you cry. Hemophilus do cry. And painless is feel less, right? So, mind you, we are talking about here the ulcer, but also they have specific lymph nodes associated with them. We will talk about that sometime else, right? So where were we? We were talking about pain, right? So, like I said, syphilis, there is no pain. Syphilis, no pain, right? And trophic ulcer. What is a trophic ulcer? Trophic ulcer is usually associated with the diabetes or any nerve lesions, right? Because there is no sensitivity, the nerve is damaged and the sensitivity is gone. So you are not aware of the repeated trauma that something any one of your limb experiences, or you are not aware of whatever is happening, so you don't rest properly. And whenever we don't rest, then the ulcer which obviously will not heal and turn into chronic. And since the sensation is gone, it is all of this sensation gone, that's why painless. So we'll see what these are, right? These just if you're in fourth year or if you're in third year, this will sound look like mumbo jumbo, right? And you'll be like, oh, I'm familiar with this term, but I don't know exactly where. Now you'll know from where it exactly comes from. So tabes dorsalis. So let's just break down the term. What is a tabes and the dorsalis? So in the spinal cord, there are dorsal column, right? What do you mean by dorsal column? Um, if we make this, there is the spine, right? Right. And something is anterior, something is posterior, right? Anterior is what? Anterior is what? Ventral, right? And posterior is what? Dorsal, right? This much we know, right? So, tabes dorsalis, what it would be, right? The dorsal column problem of the syphilis, right? Um, the dorsal column problem of the syphilis. It also is something because what is spinal cord, it is associated with CNS, right? Central nervous system. So it would be again tertiary syphilis. Why? Because I told you, for the tertiary syphilis there is systematic involvement, right? So dorsal column, what is the dorsal column, what does it do? It's in the spinal cord, so it must be very, very important. So it does conscious proprioception. What is proprioception? It is basically joint position sense. Um, if you whenever you are sitting and you suddenly are thinking about your arm or about your leg, but you're not looking at it, but you're still aware of where it is. So there is this subtle knowing of wherever your body part is, right? So if you're doing it consciously, right, you're consciously aware, right? So that would be the tract would be taken up by the dorsal column. You're consciously aware of it. So obviously, if conscious is here, where is the unconscious part? Unconscious proprioception is taken up by the cerebellum, the master regulator of our body balance and life in general. So cerebellum takes that, but for the conscious thing, we do this, right? Or other things that the dorsal column takes is the vibration, right? Your the sense of vibration that is felt by your sensory receptor is taken up by this. And touch, again, touch is taken. So touch, vibration and proprioception, so all of this will be gone in tabes dorsalis. But like we said, only dorsal part is gone, so all of the anterior part is there, motor tract is there, no other things are normal, pain and temperature are normal, but these three are gone. So, moving to the next, there is transverse and myelitis. So, let's again break down the terms. Transverse. There is a transverse section, right? Of what? We're obviously talking about nerves, right? The spinal cord. And myelitis. What do you mean by myelitis? What is the myelin here? Myelin is the covering, right? So, itis is inflammation. So, usually there would be a history of GI and respi infection, right? So, after that infection, there are some antibodies. The etiology is not exactly known, but there are some antibodies that produce this acute flaccid paralysis. So, what is the flaccid paralysis? What is a paralysis? First of all, paralysis is just the motor system of your body is not working. Like you can't do anything with your limbs or whatever, right? Um, then there is the acute part because it was, fairly recently after the infection. What is the flaccid part? Flaccid means the body is just, uh, they, for the paralysis part, there are two things. It can be flaccid or it can be spastic. Flaccid is like there is no, signal to the muscle, so you can't do anything with it. But this, what is spastic paralysis? The muscles are in spasm, so they're so tight still they can't do anything, right? So this is a flaccid part, and this is associated with the lower motor neuron, right? Lower motor neuron is anything in the spinal cord that is after the spinal cord and beyond, that is after the anterior horn cells, right? That is the Lakshman Rekha of upper motor neuron and lower motor neuron. So moving on, what is peripheral neuritis? It is normal like nerve damage that can be associated with diabetes or anything, right? Next, we were talking about all the painless ulcer. So these are done, right? And then the tuberculous ulcer, slightly painful, not that important. Or, but the malignant ulcer like epithelioma, right? Or the basal cell carcinoma. We know this, right? Rodent ulcer, basal cell BCC, right? It is usually in the face area, right? And locally invasive, they don't metastasize, right? They're absolutely painless to start with. Never become painful unless they infiltrate structures, right? I told you it's locally invasive, right? So locally they'll invade, then only they will cause pain, right? And the next heading would be the discharge, right? Discharge, pus is oozing or something is oozing out of the ulcer. You just note it, right? It's not that important, but it's just for, completion's sake. Serum, pus, blood, whatever. This is important. Associated disease. You have to, whatever we saw, right? All the spontaneous ulcers, they were associated with something, right? So for this, tabes dorsalis, you can see for the nervous lesion, tabes dorsalis, like we saw in syphilis, right? Or syringomyelia. What is syringomyelia? Syringomyelia is basically syrinx. There is, this is the spinal cord, right? So this is the central canal of the spinal cord. Whenever this is dilated, it impinges upon the surrounding tracts, right? Here, first, the immediate tracts are involved, and what usually happens is a cape-like distribution. So, like um, the tracts of the upper limb, which are taking up the sensory parts, are involved first. So that's why there is a cape like distribution of pain. What do I mean? Cape like distribution of, there's a Superman, right? Superman wears a cape. So in that area, there is usually problem in the syringomyelia, right? So it can be associated with the ulcer also, right? And transverse myelitis we saw, peripheral myelitis we saw, and it could be trophic or perforating. It's the same name, right? Why does it? Because it literally perforates, right? Usually, body doesn't let something perforate, right? It just stops if it's so whenever it's superficial, right? But here we don't have sensation, so it's going to perforate even deeper. And TB and nephritis. This is, I don't know what's the etiology for this. I will find out and tell you later. But as of now, let's move on. Diabetes, right? And syphilis we saw, like primary stage, cancer, tertiary stage, gamma. So, like, syphilis is filled with ulcer, right? So, I think for today, this is enough. And to summarize, in the history, what we're going to see, the mood, the duration, right? The pain, very important, and discharge and associated diseases. Thank you. I hope you like it. And if you have any comments, if you have any feedbacks, please give your comments down below.